Most people don't realize that the way they measure their blood pressure could lead to inaccurate results, which can have serious health implications. Blood pressure is a critical indicator of heart health, and knowing how to accurately measure it is vital for anyone aiming to maintain optimal health. In this video, we'll discuss 11 common mistakes people make when measuring blood pressure and how you can avoid them for the most accurate results. By the end, you'll not only learn how to measure blood pressure correctly but also how you can use this knowledge to better monitor your health. 1. Rushing the measurement process. A major mistake people make is rushing the measurement. When you step into a clinic or a doctor's office, your blood pressure is often taken immediately. However, this is not the correct way. Your body needs at least 5 minutes of rest and quiet to ensure that your blood pressure readings reflect your true state. Example: imagine walking into a clinic after a stressful morning of running errands, only to have your blood pressure taken right away. The reading may be artificially high due to the lack of rest. In my practice, I always advise patients to sit quietly in the waiting area for at least 5 minutes before being tested. 2. Talking during the measurement. Another common issue is talking during the measurement. Even light conversation can interfere with your reading. When you talk, your muscles contract, and this triggers your sympathetic nervous system, which can increase your systolic pressure by 7 points. To get an accurate measurement, ensure you are seated quietly and still during the entire process. Personal insight: I've had patients who, despite sitting for a few minutes, would engage in casual conversation, leading to higher readings. I always remind them that silence is essential, as uncomfortable as it may feel. 3. Choosing the wrong arm. The arm used for measurement plays a crucial role. Some individuals have a noticeable difference in blood pressure between their arms. Generally, you should use the arm with the higher reading for a more accurate measurement. However, if one arm is consistently higher by 10 points or more, this could be indicative of vascular issues, such as narrowing of the arteries. For poor posture, the impact of crossing your legs and lack of back support. Positioning yourself properly is essential. Many people unknowingly sit with poor posture, which can affect their reading. For instance, sitting with your legs crossed or with no back support can significantly raise your blood pressure reading. Personal experience: I recall one patient who would always cross her legs during measurements. After changing her posture and ensuring she had proper back support, her readings dropped by 10 to 15 points. This small adjustment can make a huge difference. 5. Using a cuff that's too small or too large. The size of the cuff matters greatly. If you use a cuff that's too small for your arm, it can lead to an inflated blood pressure reading. On the other hand, a cuff that's too large can give you a falsely low reading, which could provide a false sense of security. It's important to measure your arm circumference and match it with the appropriate cuff size. 6. Caffeine and blood pressure. Consuming caffeine before measuring your blood pressure can affect your results. If you're someone who drinks coffee regularly, your body may have developed a tolerance, and caffeine will have a lesser effect on your readings. However, if you're not a regular coffee drinker, a single cup could raise your blood pressure by 10 points. Personal insight: I often tell my patients to avoid caffeine for at least 30 minutes before taking a blood pressure reading, not because it's dangerous, but because it can skew the results.
7. Full bladder and blood pressure readings. A full bladder can raise your blood pressure by as much as 15 points. This is because a full bladder activates your sympathetic nervous system, which in turn raises blood pressure. Always make sure to use the bathroom before measuring your blood pressure. Story: there was a patient who came in with readings that seemed unusually high. After some investigation, we realized that she had a full bladder during the measurement. Once she relieved herself, her readings returned to normal.
8. Automated versus manual blood pressure monitors. With the rise of automated devices, people have become more reliant on them for quick and easy blood pressure readings. However, not all devices are created equal. Wrist monitors, in particular, are prone to errors, as even slight shifts in hand position can affect the reading. It's always best to use an upper arm cuff if possible. Example: I had a patient who used a wrist monitor for convenience, only to find that her readings fluctuated wildly depending on how she held her wrist. Switching to an upper arm monitor improved the accuracy of her results significantly. 9. White coat hypertension. The stress of the clinic. White coat hypertension occurs when your blood pressure spikes due to the stress of being in a medical environment. This is a common issue affecting up to 20% of patients, and it can artificially inflate your readings by up to 30 points. Story: I once treated a patient who had consistently normal readings at home but high readings at the doctor's office. After further evaluation, we determined that her anxiety about medical visits was causing her stress levels to spike. Once we addressed her anxiety, her readings normalized. 10. Masked hypertension, the hidden danger. On the flip side, some people have normal readings in the clinic but have elevated blood pressure elsewhere. This is known as masked hypertension, and it's even more common than white coat hypertension. If left unaddressed, it can be dangerous, as it goes unnoticed. Personal insight: in my experience, masked hypertension is often overlooked, but it's crucial for patients to monitor their blood pressure at home regularly to catch this silent issue early. 11. Frequency of monitoring. How often should you measure your blood pressure? Blood pressure naturally fluctuates throughout the day based on various factors such as stress, sleep, and hydration. To get an accurate sense of your blood pressure, it's recommended that you measure it twice a day, once in the morning and once at night, for about a week. Personal advice: after a week of measuring your blood pressure twice daily, calculate the average. If the average is above 130/80, it's time to consult your doctor, as prolonged high blood pressure can lead to severe health issues such as heart attack, stroke, and kidney failure. Taking your blood pressure at home can be a life-changing habit, but it's essential to do it correctly. The 11 mistakes outlined here could make a huge difference in your results, and by understanding the factors that affect blood pressure readings, you can take more control over your health. Regular monitoring, proper technique, and an awareness of the factors that influence readings are all key components of maintaining healthy blood pressure. The most important lesson here is that accurate blood pressure measurement requires preparation and mindfulness. Small changes, such as ensuring correct posture, avoiding caffeine, or using the right cuff size, can make a significant impact on your readings. Stay proactive, and always keep track of your health. It's one of the most important investments you can make for a long and healthy life. When it comes to measuring your blood pressure, accuracy is crucial for maintaining a healthy lifestyle. Many individuals make common mistakes that can skew their readings, leading to unnecessary worry or false reassurance. One of the most important things to remember is not to rush the measurement process. Your body needs time to rest, ideally at least 5 minutes, to ensure that your blood pressure is reflective of your true health status. Walking into a clinic after a stressful morning and having your blood pressure taken immediately can result in artificially high readings. Always take time to settle and relax before a measurement. Another key point is to avoid talking during the measurement. Even casual conversation can interfere with your results, as speaking can trigger muscle contractions and activate the sympathetic nervous system, which may elevate your systolic pressure. To get an accurate reading, remain silent and still throughout the process. Furthermore, the arm you use for the measurement plays a significant role. If you have a noticeable difference in blood pressure between your arms, use the arm with the higher reading to ensure a more accurate measurement. A persistent difference of 10 points or more between your arms may indicate vascular issues that need medical attention. Posture is another factor that is often overlooked. Sitting with crossed legs or without proper back support can elevate your blood pressure significantly. It's essential to sit upright, with both feet flat on the floor and your back supported. This small adjustment can lead to more accurate readings. Similarly, choosing the right cuff size is critical. A cuff that's too small will inflate your reading, while one that's too large may cause the opposite, providing a falsely low result. Make sure to measure your arm circumference and use the proper cuff size to avoid this issue. Finally, I want to send my best wishes to all my patients. Always stay consistent with taking care of your health, monitor your blood pressure regularly, and follow scientific advice to keep your body healthy. I believe that with proper attention and care, you can definitely manage your blood pressure and live a healthy, energetic life. Wishing you a speedy recovery and excellent health.